and Korean kinetic acupuncture. Trigger Point Acupuncture Series. Dr. Evan Mahoney is a joint graduate from Saam University, Emperor's College in Los Angeles, California, where he earned his Master's of Science of Oriental Medicine and Doctor of Acupuncture in Oriental Medicine. Since 2011, he has been in private practice with his wife in Southwest Florida. Let's give a big welcome to Dr. Evan Mahoney.
Thank you, thank you. I just want to start off, we're going to be doing some demonstrations. So if anybody has what they think is piriformis syndrome, which could be kind of generalized lower back pain, but with this kind of sciatic nerve being pinched going down the back of the leg, if you want to do a demonstration and volunteer, we'd love to have you up here. So just think about it at the break. If you do have it, if you have a pair of shorts or a bathing suit that you could change into, after the break, that would also be wonderful. Otherwise, we got some towels that we can cover you up for privacy. So my wife's going to come up, and I got some handouts. Some of you may, I think we got enough handouts for everybody. If you got a computer, you know, maybe you don't need a handout. So we're going to hand out these handouts. My wife's going to do this. Her name is Young Oak. So she's going to hand it out. If you want one, just let her know. Okay, so today we're going to be talking on the first half on Saam Acupuncture and PTSD. And then on the second half, we're going to do piriformis syndrome. So I just want to introduce some of the doctors that I studied under. This first picture up here on the screen is Dr. Tae-Chung Chu. He was my teacher about 16 years ago, and he is my Saam acupuncture teacher. He has a book, it's an unpublished manuscript that if anybody's interested in learning about Saam acupuncture and his manuscript, you can contact me and I'll get you his contact information. So that's Dr. Chu. And right now he has a clinic in Los Angeles, Saam clinic in Los Angeles, but he also teaches in Nevada. Okay. Okay, now, part of my education, I got my master's at Saam University, which is, was in Los Angeles. And then after getting the master's, I got accepted into their doctoral program, which was a full-time salary, full-time work and education. The Saam Acupuncture Clinic, we specialized in pain and pain management. And my teacher here is Dr. Hyung-Suk Choi. He's the creator of kinetic acupuncture, which we will be spending a lot of time talking about today. Currently, he's teaching at Dongguk University in Los Angeles. Now, another teacher we're going to talk about today is Dr. Jong-Hwa Lee. He's the creator of VST acupuncture, which is called vertex synchronizing technique. These are trigger point techniques, and we're going to talk about that. He does kind of the muscle twitching, and Dr. Choi with kinetic acupuncture. When we do kinetic acupuncture, we do movement of joint or limb with acupuncture in place. And the movement exercises are generally stretching exercises. By the way, I want to mention to John, thanks for your class yesterday. This morning between 7 and 9 o'clock, I meditated on lung 7, which I think was the time of lung 7. So I meditated on the Ren and Yang or Yin Chao meridians. And it's pretty awesome. If you haven't seen his class yesterday, you can find his class. It was really good. And the 8 extraordinary meridians, that was some really mind-opening class on what I had previously already learned. But thanks, John. John Orsborn and his 8 extra channels. Alrighty. So just some pictures of our brochure from Samra Acupuncture Clinic. Now, we were specialized pain management technique. Here's Dr. Choi's credentials. It's going to be, and I apologize, this is not on your handouts. I added some pictures like last minute, so the paper handouts, you're not going to see them, and probably not on the computer either. So it's really kind of small print. If you're interested, you can get this information. But he was a Kyunghee University in Korea graduate, professor. He worked at a whole bunch of other institutions in Korea. He came over to Los Angeles 2008 to take over the doctoral program at Samra Acupuncture Clinic. So this is Dr. Choi. Those are his credentials there. And we created like an 8-page brochure. And this is my doctoral class with Dr. Zhonghua Li. He's the creator of Vertex Synchronizing Technique. I did my capstone on him. We did a clinical study of back pain and neck pain, a 1-day clinical study. So I have a whole capstone written up. But this is Dr. Zhonghua Li. Currently, he's in Irvine, California. He also had several practices in Korea, very successful. But he's practicing in Irvine, California. If you're interested in, I'll get his contact information for anybody that's interested in meeting him. Alrighty. Samra Acupuncture Center, we had an MRI imaging center in our clinic, and it was really awesome. It was such a great program. The founder of Hamsoa Children's Clinic, which I don't know, has anybody ever heard of Hamsoa Children's Clinic in Korea? It's a huge hospital. Dr. Hyung-gyuk Choi is the president. They have like 50 large-scale hospitals for pediatricians. They do herbs for children. Very successful. So he invested in the Samra Acupuncture Center at the time. And so we had a $500,000 MRI machine, or more, probably more than that. But we did MRI there. And then we called it Mobility Plus Acupuncture. In a moment, I'm going to also just introduce you to Dr. Shin. Now, Jaseng Hospital. Has anybody heard of Jaseng Hospital? You have Dr. Shin. He does motion style acupuncture. And it's like a kinetic acupuncture. Dr. Hyung-suk Choi was, I think, involved with their program in Korea. Jaseng had a few branches, I think, in Los Angeles as well. So anyway, they called it motion style. When we were creating the brochure, Dr. Choi and I, we were really close. I mean, he just came from Korea, and I was his chauffeur. He didn't drive. So I would spend all day long with him in the clinic, outside of the clinic. We would be marketing to all the other places in downtown Los Angeles. So we brainstormed, and I came up with the idea of Mobility Plus Acupuncture, which I don't use anymore. But it was funny because Mobility Plus is kind of similar to motion style. I mean, it was pretty funny. I came up with that independently, and he's like, well, okay, let's use it. So this is the MRI, and then, like, for instance, I'm going to read what it says under here, and it says, keep your arms swinging, 1, 2, 1, 2, 1, 2. And leads the instructor as a young man performs what appears to be a former vigorous military march. This man is not in training for the army. He is being treated for back pain. If you look closely, you can see that he has barely visible acupuncture needles in his arms and legs. This is part of Samra Acupuncture's Mobility Plus Acupuncture. This unique treatment of needles and movement has helped alleviate severe and acute pain in many of our patients. Most patients experience immediate relief. So that's an idea of kinetic acupuncture. We would do a march around the clinic, and this is the picture where there would be 2 of us, and this would be the patient, and he would have points, generally do 4, do 16, LI 11, stomach 36, and we would have a march around the clinic with the needles, opposite arm, opposite leg. We would say, pretend like there's a piece of string lifting you up to the sky. And if they're really in bad shape, then we would have to support them one under the shoulder. So me, I'm pretty tall, and it's really funny because I had really bad back pain. I just started, and we're going to talk about Dr. John Sarno in a moment, but I got really bad back pain for the first time in my life, like days before starting this clinic. So I walked in there like limping, and then I would have to lift the patient up with my back pain, and I was both a patient and practitioner at the same time. And actually it was a great experience. I mean, it was a blessing. All my illnesses turned into blessings because acupuncture was the solution, and it was my education to be a patient, a suffering patient. So here's the second page of the SAMRA brochure, and we just kind of like thought of the spine as a mast with the muscles supporting the upright mast, and if there's a muscle tightness or tension, it will pull the spine out of alignment, and we want to align the spine. So just a concept there. Okay. And also this kind of bicycle was kind of a structural idea. When you see the old pictures of the gentleman riding on the bike, they always have their back like straight, like very good posture. So that was the idea with the bicycle. All righty. We are going to now move on in the conversation, and I want to talk about qi. So how many people meditate here? Can you raise your hand if you meditate? Awesome. I mean, this is like 80% of the people meditate. Okay. How many can feel qi when they meditate? Awesome, about 80%, 75%. Okay, how many meditate on the acupuncture points when they meditate? Awesome, awesome, awesome. My wife does it. So now there's a little bit less hands there. So we're going to talk about meditating on the acupuncture points, which is Saam Acupuncture. Now, I want to talk in general about the treatment, and I think whenever we do an acupuncture treatment, no matter what we're treating for, I think we have all the same goal. During that treatment, we want the patient to be as relaxed and as comfortable as possible. Would you agree with that? Yeah, okay. So this brings me to this idea of myoclonus. Have y'all heard of myoclonus before? No, okay. I think we've all experienced it though. And I kind of think of this as how qi operates in us. It's almost like a visible example of qi. So when we are relaxed and comfortable, qi rises to the surface. Now I don't go into the physiology of what qi is. I just say, simply understood, it's energy. It's a propulsive force for growth and healing. So when we are comfortable and we're relaxing, the qi kind of comes to the surface. It rises, and it encounters, well, for growth and healing, it encounters blockages, whether it's a growth blockage or a traumatic blockage, injury blockage, illness blockage. So when the qi rises, it comes to the surface and it meets these blockages. Now, myoclonus, I think we've all experienced this. You're watching TV at night on the comfortable couch or chair, and you just start nodding off, and then all of a sudden, boom, the body jumps. Has that ever happened? Who's that happened with? Yeah, like almost all the hands are up. So that's called myoclonus. I don't have the Western definition of it. You can look it up. But I call it qi rising to the surface. The moment when you are comfortably sitting in your chair about to fall asleep and your body suddenly jumps or alerts. So qi rises to the surface when we are comfortable and relaxed. So I'm going to tell about my sad history of pain and illness and heart troubles. So I may or may not have rheumatic heart disease. I don't know. I'm not going to get it checked out. But I did have one of my doctors at SAMRA did give me that diagnosis based on the history I told him. So my history of coming into acupuncture starts like a long time ago. I grew up in Pennsylvania. I loved to play outdoors, winter, summer, and we would play in the snow and snowball fights, walking to the bus stop, walking a mile back and forth to the, not up any hills or anything, but still pretty cold. And so I'm going to talk about, this is all in my book here, Saam Medical Meditation. So it's a story in this book. You can buy this on Amazon. I have classes available too, if you're interested. Saam Medical Meditation, you'll hear the story. So one day I was sledding down this hill, a very steep hill called Neshaminy Hill, just a little ways from our house. And the key to sledding down this hill is that at the bottom of the hill, there's a creek. And you have to roll off the sled before you go to the creek. So it was a very scary thing. I mean, this hill is really steep and short, and the creek is down there, and it's a rocky creek. So I was trembling, but I jumped on the sled. I went down, and I froze. I did not roll off the sled. And I jumped over the creek and the rocks, and I was fortunate. I cleared the creek. The front of my sled landed on the other bank, and the back sled was on a rock in the water and the river. But it was really fearful and scary. And I was probably 8 years old, and so later that afternoon, when in the winter it gets dark early and you're wet in the feet, and you know, it was really painful feet, and that was probably one of my experiences of getting hurt by cold. Another one was a snowball fight in the cornfield next to our house, where, has anybody ever had snowball fights when they were younger, like cornfield? I mean, this is like whole army versus army. You're building a fortress. You've got your cannonball stock of snowballs that you prepared. So all the kids are just, snowballs are flying, and bang, like an ice ball, like from some big kid, like from where Dr. Wing is 10, 15 feet from me, just slams me in the eye. Boom. I mean, it must have concussed me. I don't know. But it was a shock. And it's like, oh man, my brain rattled. And I think from there, I was never the same, even until today. So in my first sign of problems was in high school. We would run the mile, and then after class, I would just be hacking like phlegm, and it just continued on for like the next 2 classes. I'm like, why am I doing this and nobody else in the class is doing it? So then it progressed. 18 years old, I had my first heart palpitation. My hands, when it got cold, would turn purple from about the knuckle, from the base of the wrist here to the fingers and the knuckle. They would turn purple. My nose would turn purple. My lips would turn purple. Lord knows what my tongue was purple, I'm sure. So whenever it got cold, purple, you know, blood stagnation, cold, you know. I didn't know it at the time. So for 14 years after that first heart palpitation, I would just get them, irregular heartbeats, palpitations, murmurs. Does anybody know? Well, I'll explain the difference between a palpitation. Palpitation is a hard pounding, boom, 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 against the chest. Irregular heartbeats, murmur is a boom, 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 brrr, boom, 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 brrr. Ventricle fibrillations. I had probably many episodes of ventricle fibrillation, which is like deadly. Anybody ever hear the book The Perfect Storm by Sebastian Junger? This is back in the 90s. It was released. They made a movie out of it, and he had a really interesting description. It's a story about a fishing boat in New England, and they get caught in the perfect storm, like just the huge waves, and the boat was lost. The crew was lost, and Sebastian Junger says, as they drown, the heart ventricular fibrillation is like a bag of worms. And when I read that, I'm like, oh my God, I can relate to that. But that's very deadly. Ventricular fibrillation, like, you're not going to live long, you know, without help. So, or rescue, AED rescue. So 14 years, just all kinds of irregular stuff. Like, I could be sleeping at night comfortably, and I wake up out of a dream, and my heart's like clunk, 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 and I'm like, what the? I was sleeping. What triggered that? You know. So I pulled away from society. I would know, you know, any activity in sports or anything. No, I can't do it. Socially wise, you know, the heart is like the tongue. Well, I couldn't even speak. I mean, I had such a soft voice, and I still do probably, but, you know, I mean, I couldn't socialize at all. So I just withdrew, figured I was going to die, you know. So I call it like 14 years in the wilderness. In Los Angeles, I had a case of atrial fibrillation, which may not have even been part of my, like the underlying heart problems. I was doing labor work, construction, and it was hot afternoon, sweating. We went out to lunch, and I drank my first ever frozen smoothie, and I sucked this thing down at lunch, like just sucked it down. And the ice, literally like ice, if you do that, will kind of freeze the electric connections, and it'll precipitate a fibrillation. So I'm like, ooh, I'm having a heart attack, you know, call the ambulance. So they take me to the hospital, and for like, well, I was in the hospital in the emergency room for 6 hours. Twice they stopped my heart with the intention that when it starts again, it'll resume its normal beat, which it did not. And if any, that was interesting, like to have your heart stopped. That's the moment where you're like, you know, that's like the moment like you're passing on. So I'm glad I had that experience. I mean, it was pretty neat actually. And the nurse, I mean, it's scary, but so it didn't really stop my heart, but I didn't have insurance. So they sent me home, and my heart's still kind of going. I took the bus. I was, you know, labored, you know, no insurance. So, you know, it did resume normal beat the next day. So, but that was my first, like, okay, I got to get this problem addressed. I never went to Western doctors or anything. So I go to the Western doctors, and, you know, I'm taking the bus 2 hours because I don't have insurance to these clinics that you got to wait 3 hours. And the doctor sees you, oh, cold hands, warm heart, you know, and my hands are cold right now, actually, easily cold hands. We'll maybe I'll try to remember that one for the class, because I always ask my patient, do you easily get cold hands and feet when the weather turns, I'll talk about it. Do you easily get cold, who gets easily cold hands and feet when the weather turns cold? Okay, good. So we are more vulnerable to the cold influences. And we're going to talk about this with muscle trigger point. So we have to protect ourselves from the cold. And we'll talk more in that. But yeah, doctor, cold hands, warm heart, oh, give them digitalis, you know. I wear the Holter monitors, and fortunately, like, nothing ever irregular came up with the 24 or 48 hour, you know. So I didn't really pursue the care. I never took the medications that the doctors prescribed. So, oh, I got to hurry up a little bit. So I went to acupuncture. I had a really bad episode one night where I was doing a yoga thing, and my heart just like a string just separated, and my heart just palpitated the whole night, just irregularly. So I in desperation, I found an acupuncture doctor in the phone book, and my first treatment the next day, I go in the clinic, and he does the points. I didn't know anything at the time. PC6, stomach 38, I think lungs 9 or lung 8. So he just says, oh, meditate, you know, lie down and meditate. So I have good treatment. You know, he takes the needle out of stomach 38, and I thought I felt something to, oh, that's interesting. But he didn't put any needles in the heart. And I said, hey, doc, why don't you put any needles in the heart? You know, I got this heart problem. And then I told him I was doing a meditation. I would do visualization meditation where you image the heart in its 3 dimensions. And he said, don't do that meditation. You're putting too much pressure on the heart. I said, oh my God, what? So I went home and I said, okay, he's putting a needle here for my heart, so this has got to be good for my heart. So I lay down on the ground, and I would pretend I was still getting the acupuncture treatment. And just all my meditational focus was on those points, on PC6 and the wrist. And after 3 weeks, I started feeling, I mean, pretty quickly, I started feeling chi by doing this, a slight tingling sensation, a throbbing, pulsing. And I was like, what's this, man? It's like, is that an artery? And it got stronger each time. And I was meditating for like 8 hours a day, 6 to 8. And it's never stopped. I still meditate 8 hours a day. And that's 18 years ago. And every day, meditation. My wife will testify. She thinks, yeah, never mind. You know, I go and I say, doc, man, I'm getting these weird sensations, you know, and tell him, and he said, oh, you're sensitive to chi. I said, chi, what's that? Well, I didn't ask, I didn't pursue it, but I guess it's a good thing, so I'm going to keep doing it. So 3 weeks into this, I was coming back to my apartment, and I had a sequence of palpitations right outside my apartment. So I go upstairs, and I lie down, I meditate, I feel the tingling, and I felt like a release of pressure just go right from my chest, right down those points. And oh my gosh, I've got control over this. That moment was my first moment of getting control over my heart palpitating. And this is, remember, you know, I would wake up and my heart would be just irregularly beating, nothing, anytime, unpredictable. So I said, man, I got control over this. So 2 months later, I enroll in acupuncture school. And about a year into that program, I am introduced to Dr. Chu And I regret I didn't bring his book in. It's just an unpublished manuscript. But this is the first, and within about a year, this is the first chapter in his book. And it's Master Saam was a monk, one of the great physicians of the Choson dynasty. Sa means dwell, Am means rock. Let me just set the timer here. So, like other high priests, he didn't know his real identity. The only thing we know is that he lived in a stone cave and treated many people. After meditating for many years in the cave, Saam opened his mind's eye and saw through to the core of acupuncture's mystery. So that's from Dr. Chu's classroom manuscript, unpublished. Again, you can reach me if you want it. I've gone on to write, like, I don't even know how many books. This is the first one, Saam Medical Meditation. This is Advanced Combinations. We're going to talk about this. Structures of Knowledge, we're going to talk about that. So, all right, got to move along here. Post-traumatic stress disorder. Now, we are going to talk about organ-centered consciousness. I think acupuncture is called organ-centered consciousness. Who, when they were a student on their first days of learning, did not start to identify themselves as, oh, I've got spleen qi deficiency, or I've got liver qi stagnation. Didn't our minds change at that moment? We're thinking about organs, and all of a sudden, it's not the brain anymore. And we all know, like John was saying, the brain is what, a special organ, or, yep. So not much emphasis on the brain there, but the organs for sure. So this is organ-centered consciousness, and I want to start talking about PTSD. This is from the military. A study, there's 4 symptoms of diagnosis of PTSD. Reliving the event, also called re-experiencing, avoiding situations that remind you of the event, feeling numb, feeling keyed up, and also called hyperarousal. So I'm going to focus on these first two, reliving the event and avoiding situations that remind you of the event. I'm not going to go through this. I don't have time. MindFit, this is on the handout. You can read it. But you're going to see a technique where they're doing this technique where they're bringing the soldiers' attentions to their feet, the sensation of their feet on the ground, which is very similar now to we're going to be talking about the kidneys. So the kidney role with PTSD, fear is a physical disease and it resides in the kidney. We all know that, right? Shock harbors in the kidney. So I don't have to explain that. Water, the element of kidney signifies danger. And so let me just skip through this because we don't have time. You can read this here. And then, okay, so we all know kidneys fear. Now, in the Saam acupuncture technique, the Sanjiao has an energetic function of expelling wind, okay? So we're going to use this. Now, this is part of the advanced harmonized combinations I use. I use kidney 4-needle technique, and this is Saam's also called the Korean 4-needle technique. I use the kidney on one side and the Sanjiao on the other. So kidney is Shao Yin channel, Sanjiao is Shao Yang channel. They have a harmonious combination, yin and yang. So I love doing this technique. I meditate on this. This is what I meditate like thousands and thousands of hours. This is the practice I do in my clinic. One side is the yin, one is the yang. Sanjiao has an energetic function of expelling wind. Now, these are the point prescriptions. This should be on your handout. Does anybody have any problems or questions at this point? No? Okay. So these are the point prescriptions down here on the left side. Let me go back up here, actually. These are the point prescriptions that we do for PTSD. There's really no variation. I don't add any extra points other than these. So generally, on the left side, I do the kidney, and on the right, I do the Sanjiao. probably don't have time to explain that, but if you have questions on that, I'll answer them in the break. Kidney 4-needle technique, lung 8, kidney 7, these are points number 1 and point number 2. These are the 2 chief points of the kidney junkyuk. And the construction of the Korean 4-needle technique is the same as the 5-element, 5 phases. You tonify mother, and then you sedate grandmother, the grandmother points. So the points 1 and 2 on the kidney are tonifying the lung points on the lung channel and the lung point on the kidney channel. Oh, I'm sorry, the lung point on the kidney channel and the lung point on the lung channel, sedating the spleen point on the kidney channel and sedating the spleen point on the spleen channel. And then the Sanjiao is Sanjiao 3, and gallbladder 41. So gallbladder is the mother of Sanjiao, gallbladder point on the Sanjiao, and then spleen 2, and what is that, UB? I can't think right now, but UB 66, right, thank you. Okay, so these are the point prescriptions. I also add these mu points, the mu of the kidney and the large intestine. This is kind of the opposite on the circadian clock of the kidney. I incorporate this. I like it as a triangulation. There's 3 organs that we're kind of meditating on, and we are going to meditate on these points. And then the mu of the Sanjiao. These are the points for PTSD right here. Now, remember, I'm going to start coaching you on the technique. Fear is a physical disease, and it resides in the kidneys. So during the acupuncture treatment, that's what I tell the patient. I want to bring them out of their head while still being in their body. And so this is the technique. I do the tonifying points with breathing. You're going to see the breathing instructions later on the handout, where I do tonifying points. I do a 6-breath technique, and okay, I do a 6-breath technique. The first 3 points, I have them reimagine that scary moment, because I want to have them kind of get an adrenal response. And okay, so fear is the physical disease of the kidney, and it corresponds to Western medicine. The adrenal glands sit on top of the kidneys. They release adrenaline in the fight or flight response. So if you ever get a scare, a fright, a dog barks suddenly, whoa, and afterwards you can be aware of that adrenaline in the kidneys, and that's chi. We'll call it chi. Why not? And you can direct it. Where the mind goes. I want to ask this: who's heard of where the mind goes, so goes chi? Okay, very good. We've all heard it, but I'm like, I don't remember where I heard it from, what the source is, but maybe it's a Tai Chi, Qigong thing, but that's a major principle. Where the mind goes, so goes chi. So you're aware of this fright, this adrenaline, well, you can direct this energy, and that's what I coach my patients. I say, okay, on the first 3 breaths, remember this frightening event, and I don't get into details. I don't want to know what the trauma is. It's all the same. It's not. There's terrible traumas that I've never experienced, but as far as it's rooted in the kidneys, is all the same. And I don't mean to be insensitive there, but I'm not going to go into detail. I don't want it, and they may not want to diverge the details, so I'm not going to get that personal with them. But anyway, I just say, imagine the event, try to feel that if there's any adrenal response, and I want you to send the energy here to this point and this point here, the 2 tonifying points in the kidney junction. I'm doing the 9-needle stimulation clockwise, and I'm doing a breath where I have them do a 3-breath. It's when they hold their breath, and as they exhale, I'm tonifying technique on those 2 points. And then as they inhale, I do the sedating technique on the reducing points. 3 breaths. And then I say, okay, now we're going to go over to this side here, the Sanjiao. Now I want you to take that energy and send it to this point here and this point here, and just expel it. I've told them this is the expel out of it. Just get it out of your brain, get it out of your body, send it down here. Don't let it live up here. And it's really interesting. On these 3 breaths, sometimes you'll hear the patient as they exhale, and I'm doing the same, tonifying the tonifying. As they exhale, they'll be like really pushing it to those points. They got it. They're pushing it out. These are the points to simply expel the wind, to simply forget. In my opinion, I think the way to overcome PTSD is you just simply forget, expel it out. And then I coach them. This is something they can take home with them. They can do this anytime. If they get a fright, remember those 2 points and send it out. Send that energy out. Feel it in the adrenals and send it out. Don't relive it. Remember the PTSD you're reliving, re-experiencing, like if you go through a car, if you had a car accident at an intersection, the next time you go, you reimagine it, you relive it, you get tense. So we want to expel that. That's consciousness, by the way, and I don't have much time. We're going to talk about unconscious versus consciousness. Are y'all with me? Okay.
Which 2 points?
Kidney on the what?
Which two as they're breathing it out?
Yeah, I think I got the breathing exercise pretty detailed on the next page down.
Thank you.
So we can talk in private on that one because I just don't have the time. But I did my best to like really make it as detailed as possible there. So I think it's on the next 2 pages. You can read through that. I want to talk about Dr. John Sarno real quick here. This is kind of like a consciousness versus unconsciousness distinguishing. So I equate kind of PTSD as part of the consciousness. So that means maybe kidneys dominate consciousness. Now, unconscious. Who's heard of Dr. John Sarno? Good, good, good. He coined the term unconscious rage. Now, I'm going to just kind of keep it short here, but you can compliment your patients on this one, and it's great. It's so wonderful. It's an introduction to the unconsciousness. You can compliment them. Are you a successful person? Are you a do-gooder? You highly achieving? Do you take on a lot of responsibilities? The patient's like, yep, that's me. Well, unconsciously, there is a conflict because the id, and this, Dr. John Sarno, the id hates these responsibilities, and it develops unconscious thoughts about, like a new mother example would be the responsibilities of a new mother. She may want to unconsciously abandon the baby because she doesn't want to take care of it or hurt the baby. But these unconscious thoughts build and build to a dangerous level where, you know, I'm going to act out on this. No way. It's the ego. It would destroy my life, which is kind of the ego-driven life, everything you're trying to accomplish for yourself. And the ego says, no, my God, if I was to do that, it would destroy my life, everything I worked for. So as a form of repression, the ego suppresses these unconscious thoughts. Now, Dr. John Sarno passed away a few years ago and wrote several books in the 1980s. His first one was Heal Your Back Pain, which he introduced. And he attributes the form of repression as lower back pain, socially acceptable disease that you can garner sympathy from, as opposed to, oh, I've got a psychological problem. I got back pain. Oh, help me. You know, it's more sympathetic. You get more better response. So as a form of repression of these unconscious thoughts, triggers back pain is so severe, you just kind of repress, you don't think about them. Then he, in his later books, he goes back to earlier epidemic diseases, stomach ulcers of the 50s, hysteria of the turn of the century, 20th century. So now, interesting, unconscious rage. In Saam Acupuncture, there's a chapter in Dr. Chu's book, which I latched onto because one of the aspects of gallbladder is revolutionary rage from injustice, anger. Now, I've kind of also would say, I kind of lean on the Sarno, unconscious rage from intractable family stress situations, relationships that are intractable, generally building. So this is the gallbladder heart channel that we do, and these I pertain to the unconscious. I think the heart has a lot of unconscious attributes about it. We could really have some nice discussions, but I think this is unconscious. I think PTSD is consciousness. Kidneys, I think of kind of heart, gallbladder. Now, I think actually these unconscious things, especially the demons, we can talk about demon possessions, hauntings, all the bad stuff is in, and I call it the Xiao-Yang realm syndrome, where the weird, synchronistic, unnatural, supernatural events happen when we're in moments of high stress and tension. Weird things can happen, and that's in the Xiao-Yang realm. Hauntings, and obviously possessions, we want to expel that stuff. And the gallbladder, by the way, expelling wind, I like the Sanjiao, out of the body. We want to expel that stuff. So I have the heart gallbladder points here. Very similar. This is the heart on the left, gallbladder on the right. Time check, Raphael. What?
We have about 35 minutes before the
Okay, good. Does anybody want to do a PTSD demonstration for a kidney channel technique? Okay, good. So this is going to be demonstration time. Let me just make sure I wrapped up the loose ends here. And again, any questions on this gallbladder, heart gallbladder, you can just talk to me personally. I've got all this in my books. You can get them on Amazon. So at this point, I think we can do a PTSD demonstration. So I'm going to clear the table. If you can come forward, please. Yeah, I got one here. Okay, so this is the kidney. Have you ever had acupuncture before?
Yes.
Okay, good. So it's not your first time. And that's a typical question I like to ask my patients out of habit. Yeah. Okay, so on the left side, I do the kidney channel technique. The yin, left side, the pulse tonifies blood. The heart, liver, heart, liver, they tonify blood. Women in general, the theory goes, has more blood, and men have more chi. So, anyway, I'll get into it later. Let's do the technique. Okay, and then we're going to do these mu points. Kidney. Okay. Y'all set? Y'all set, hon?
Yeah.
Oh, sorry, my wife.
That was the hunch. Yeah, exactly. I should have clued me in.
Sorry, my hands are cold, so it's going to be kind of a shock. Okay. Good. Good. Okay, I'm going to do it down here for a minute. A couple points. This is the Korean 4-needle technique. These are this is point number 1, that's point number 2. Tonify mom, the lung channel on the kidney and the lung on the lung. This is point 3, sedating the grandmother point on the kidney channel. So that's kidney 3, spleen 3, and alrighty, we're going to go to the Sanjiao. Sanjiao 3, the mother point on the Sanjiao, the gallbladder point on the. Are you okay with him?
Yeah.
You're doing very well.
What's the gauge of your needle?
This is like 30, 38.
Okay.
These are facial needles.
Yeah.
You probably barely feel them.
Yes, that's
Yeah.
why I'm asking.
Gallbladder 41.
This is like reading them.
Yeah. Very kind of simple. Elegant. I think it's elegant. I think of like 2 pistons, like a yin and a yang piston, just harmony.
Is this like similar to Tan's global balance? Like, is it, I'm just asking.
Well, yeah, and I forgot the research because actually a lot of my theory is based on 10.
Okay.
Do you know like
This looks like a global balance.
Yeah. Do you know his 5 kind of sequence, 5 how to connect the channels, like 5 ways that you can connect channels, like Sin, Shao Yin to Shao Yang, and kidney to kidney to urinary bladder.
Yeah,
And-
really think about that.
And then I think.
In a certain order?
Sorry.
Are you doing them in a certain order?
Basically, I do
Yeah.
the tonifying points first.
Okay.
And then I do, I usually do it doesn't really matter. I mean, I don't think it matters. But in this case, it is actually important order. I go to the kidneys first, and then I do Sanjiao, and then I do the front mu points. The reason I asked about 10 is I forgot to research. Does he have something where you do 12 hours opposite the circadian clock?
Yeah.
Yeah.
Yes.
Yeah.
Okay.
Yeah,
So that's what this is here. We're doing large intestine front mu points. And that's based on the 10, 12 hours opposite the circadian clock. So 12 hours opposite the kidneys. Wait a second, is that right? Large intestine, that is right. So 12 hours opposite the kidney is the large intestine. So I get the large intestine on this technique. If the kidney's the chief, sometimes with women I make the Sanjiao the chief, and then I'll incorporate the spleen point because that's 12 hours opposite the Sanjiao. And then I would do the spleen mu. Would you like that? I'm going to do that for you. So I do distinguish between men and women on that case.
We're gonna do, for women, I kind of do the yang as the chief, because again, now this goes back to men and women. Men typically have more yang, women have more yin. So we want to tonify that which is deficient. So we want to tonify yang for women and tonify yin for men. So generally with this technique, the men will be, the yin channel is the chief. In this case, we're gonna make the Sanjiao the chief channel here for. So there's just a little variation that's not in the notes, and that's because the female, male, I did the male presentation in the notes. Okay, now, fear is a physical disease, and it resides in the kidneys. Does that make sense for you? Yeah. So I want to bring it out of your head, and I want to focus on these. The kidneys reside in the lower belly, okay? And gosh, I mean, we all know the kidneys, like the treasure is like right down here. So I want to bring your attention down to these points here and here. Now we're going to do a 6-breath sequence. The first 3 breaths, I'm going to bring your attention here to this kidney side. I want you to just momentarily imagine like a traumatic event, whatever, fright from an animal, whatever, but you don't have to tell me. And then I want to see if you can kind of trigger adrenal response down here. And then I want you to channel that to these 2 points. Right now, for these first 3 breaths, these are the chief points that I want you to send everything to, okay? Does that make sense? Mm-hmm. Okay, so can you take a breath through your nose, please? Hold your breath. As you're holding your breath, I want you to direct everything down here and here, and you can pretend like you're sending the breath even down to the kidneys. We all know the kidneys grab the chi of the lung. Now you can breathe out very smoothly, softly, gently from the mouth. Good. Are you okay? Mm-hmm. Okay, take a breath in. I'm going to sedate these sedating points. Hold your breath, please, Ruth Ann. Once again, direct your attention down here and here. And then you can breathe out very smoothly, softly, gently. Good. Okay, we're going to do one more breath. Take a breath in, please. Okay, hold your breath. And then direct your attention again here and here. Okay, now I'm going to go over to the right side next. You can breathe out very smoothly. Remember these points. Okay, now, I want you to now just take that and push it all out of your head, out of your body. These are the expel points. So take a breath in again, please. Hold your breath. Send everything out of your head, all the way down to these far, far away points. And you can breathe out. Just send it out. Good. Okay, take a breath in again, please. Okay, hold your breath. Okay, hold your breath here and here. And then breathe out. Again, just send it all out. Just send it out from the kidneys all the way down. Okay, and then one more time. Take a breath in. Hold your breath. And then here and here. Breathe out. Okay, now, before I let you go, every 5 or 10 minutes, you can do a 3-breath sequence on your own. And it's when you hold your breath, and as you're exhaling, I want you to remember the impression of these points here and here. So every 5 or 10 minutes, you can do a 3-breath sequence on your own. This is where I say I'm going to leave the table. If you need anything, you can make a whoop, whoop kind of noise. And I'd like you to go, do you think you can go 10 minutes just lying like this? And we're going to leave you alone.
Definitely.
Okay. So maybe we can go to the back. I'm going to take a little break here while she goes into the acupuncture. And then anybody has any questions, we can talk in the back. So I'm going to leave you with one more breath. Take a breath in, please. Hold your breath. It's here and here. You can breathe out very smoothly, softly, gently. We'll go 10 minutes and then I'll come back. Is that you're still getting the stimulation of the points. So when you go home tonight, if you get a chance to lay down and relax, you can pretend like the needles are still there and you can meditate on it. And if you ever get a fright, try to remember those points on the right side. Alrighty. All the needles are out. So do you have any questions?
Not right this second, but probably.
Okay. Yeah, just go ahead.
Relaxed.
Yeah, that's good. So that's the most important thing. Most important thing is that they're relaxed and comfortable. Thank you so much.
Thank you.
Don't forget your mask too.
Oh, yeah.
Okay. Does anybody else want to do one? I think we got time if anybody else wants to do one.